Bonjour et bienvenue à cette conférence.
Hello and welcome to this press conference to provide an update on COVID-19 in Quebec.
Donc, la conférence de
presse, the press conference will unfold as follows. Minister Christian Dubé will have some opening remarks, and then there will be a question period with the media. And the Public Health Director, Dr. Horacio Arruda, will also be available to answer questions. Without further ado, I am pleased to hand it over to Mr. Dubé. Hello, everybody. Hello, Dr. Arruda. First and foremost, I must admit that I would have liked to be here today with better news. The number of cases is still around 2,200 cases over the past few weeks, and there's even been a slight increase over the past few days. I would like to talk about 3 points. First of all, the travelers, people traveling abroad. What I am also worried about is the people who made the decision to travel despite public health recommendations. We want to avoid reproducing what we saw after spring break. And actually, we asked the federal government, who's responsible for applying the law on isolation, to put in place 3 measures. First, there must be a requirement to be tested before getting on a plane back to Quebec. Secondly, we've also asked screening in airports, international airports. We're talking about Montreal and Quebec, with rapid tests for travelers who are coming back to Quebec. And mainly, and I'm insisting on this, an intensification of the follow-up to make sure that people are respecting the quarantine, which is a federal responsibility. We've had several discussions on this with our counterparts at the federal level over the past few days, and the federal government is talking about the application of these measures, the 3 measures that I've mentioned, for the beginning of January. I've indicated that this was not quick enough. It's a request that we've repeated during our daily calls that we've got with the federal government. And I'm saying this, it's not fast enough to wait for next week. The images that we've seen of travelers down south are shocking for everybody, especially for those who are following the rules and the healthcare workers. Now, we have to remember what's happening here. It's all fine to talk about travelers, but the community transmission, as we know, and Dr. Arruda will reiterate this, and the number of hospitalizations is constantly increasing. So a few words on the situation in hospitals. The situation is critical in some regions, specifically in the Greater Montreal region, as are the INS forecasts that came out last Thursday have demonstrated. The increase in cases is 5 times greater in the Greater Montreal region, which has more than doubled over the past 4 weeks. For those who are following this, we've got close to 1,000 new cases in the Montreal region, so the forecasts indicate a significant increase in the occupation of beds in the next few weeks. We will go beyond our capacity, and half of the designated beds are already taken up. So we have to remember why we're making these sacrifices. It's to decrease the pressure on our hospitals and to avoid even more postponements in services and decrease the pressure on our healthcare professionals. Lastly, a few words on vaccination. I would also like to say a few words on the vaccination, which is going well. We're following the game plan that we have established. We are getting close to getting through all the Pfizer doses, which will happen in the next few days. So we're respecting the plan, and this proves that as soon as we receive the first doses of vaccines, we administer it in the days that follow. However, we've got instructions from the manufacturer to keep half of the vaccines that we are receiving to administer the booster shot, as we agreed upon with Pfizer, and that is what we're doing now. However, like in other jurisdictions, we're wondering about this request to keep the second dose, and we will see in the next few days if there will be some changes to this approach. I would also like to remind you, and that's good news as well, that we will be getting some Moderna doses soon. And what's important for Quebecers to remember is that we have the capacity to vaccinate. according to the number of doses that we will get, we'll continue to do so. In conclusion, I would like to say that the situation for me is very worrisome. We are not heading in the right direction. I know that this is not what people want to hear, but there are people who are dying every day, unfortunately. Our hospitals are getting close, dangerously close to their capacity. You'll remember that I had said that if we continued this way a few weeks ago, that we would hit a wall in January. Well, unfortunately, we're getting close to that wall now. The only way to not hit a wall in January is to respect the public health regulations.
The number of cases has been around 2,200 cases in recent weeks. What also concerned me a lot are the people who made the decision to travel despite the recommendation of public health. We want to avoid repeating what happened after the spring break. We asked the federal government to put in place 3 measures. First of all, it takes an obligation to be tested before taking your plane back to Quebec. Also, screening was requested at airport using rapid tests for travelers returning to Quebec. And above all, an intensification of the follow-up of the respect of the quarantine, which is a responsibility of the federal government, will be asked. The federal government tells us about the implementation of these measures in early January. To us, this is not fast enough for us. We would like these measures to be put in place in the coming days. We must not lose sight of what's going on here. Community transmission is important. The number of hospitalizations in Quebec continue to increase. The situation is critical in some regions, particularly in the Greater Montreal area. An overrun of dedicated capacity cannot be ruled out, especially since half of those designated beds are already occupied. I would like also to say a brief word about the vaccination, which is going smoothly and following the game plan that we had established. We're also had to run out of the first doses of Pfizer, which will be done in the coming days. We have the manufacturer's instruction to keep half of the vaccine we received to administer the second dose. This is what we're doing now. However, like other jurisdictions, there are questions about this request to keep the second dose. To conclude, I want to say that the situation is very worrying. We're not going in the right direction. The only way not to hit a wall in January is to follow public health guidelines. Thank you. Merci beaucoup.
We will now go to the question period. We'll start with the French questions. So 1 representative per media. So 1 question and 1 follow-up question per reporter. Question.
La phrase la plus connue dans la pandémie, vous êtes en mode muet.
Yes, the quote of the year, you're on mute.
D'ouvrir votre micro, Monsieur Thériault.
Alors, est-ce que ça fonctionne bien?
Oui, on vous entend bien, Monsieur.
We can hear you.
Alors, désolé pour ce petit incident. Alors, je reprends. Monsieur le ministre.
Mr. Minister, what do you expect from the federal government exactly when it comes to the follow-up? Can you explain the responsibility of each? For example, a phone call at home for 2 weeks, or what do you want? Who's doing what in this? Well, that's a good question. The responsibility for this law on travel, particularly in airports, is a federal law. And the first thing that we would have liked is that there be no trips abroad. We had asked for this and the federal didn't agree. I would like to say, however, that our discussions with the federal government are very good. What I find, though, is that things are not moving fast enough because there's a very good level of communication. I will go through the 3 points because we agree on the 3 points, but it's on the timeline that we don't agree on. And I'll go back through the 3 points because it's important. The first point for me is very important, and I congratulate the federal government for being in agreement and that is that people get tested at their departure airport. The people are in Cancun or they're, regardless where they are, they will have to get a test, a PCR test that proves that they are negative before they board the plane. And whether they're in Florida and Mexico, regardless, in the all-inclusives or whatever, it is now a requirement. So those who have already left will have to comply. But I'm also talking to the people who wanted to leave in the next few days. You should know that this request will be made of you by the airport managers. So that is a request that is very important. The second one is to test on-site in the arrival airports, Montreal and Quebec. Now, why are we in discussions with the federal government? Once again, it is their responsibility to test in airports. And the question is as follows. Currently, we have 2,300 cases a day. And as I've said, it's nice to talk about travelers. But we have to think that our responsibility right now is to manage the 2,300 cases a day that we've got. And in order to do so, we need people who are doing contact tracing. So the last thing we want to do is to move people who are doing contact tracing, who are doing very important work in Quebec, and to send them to the airports, where it's a federal jurisdiction. So to be very clear, we said it's a very good idea to test on-site in Montreal, but it must be your staff, and it must be your tests, because we don't have unlimited tests. So that's the second point, and that's why we're negotiating very hard right now so that that can be applied. The third point for me is the most important. Even if we've tested at the departure airport, even if we've tested when people arrive here, what we are asking is that the follow-up with people who have committed to quarantine, who have given their address where they will be in quarantine, I have asked that not only will it be phone follow-ups, but as we're currently doing, we want to make sure that there is a follow-up on site, that people who will travel to the homes and to make sure that the people are quarantined at home. And that's currently being done on a limited basis. And we want to agree with the federal government. We want to increase these number of follow-ups to make sure that people are home. So we agree on the measures, and you understand the importance of all three measures. But this has to be done as quickly as possible. If it was up to me, we would do it as of tomorrow morning. But we are in discussions with the federal government, and we will continue these discussions over the next few hours. And one question on that first case of the new variant. What kind of measures will this bring about? Do you think there'll be a tightening of the measures? Do you have a timeline? At this pace, we'll have to tighten things up? Or I will let Dr. Arruda answer, but I do want to make a point. We know that the flights that are coming in from the UK, and we'll have a specific testing method for the flights coming in from the UK. But for the new variant, I will let Dr. Arruda talk to this. We've detected actually a new variant in a family where one of the travelers was coming back from the UK. We now know as well there are several countries that have demonstrated certain mutations. Some are more significant than others. So over the next few weeks, well, as of now, there are some questions that will be asked of people if they've traveled, and if we know that they've traveled, there will be some screening tests that will be offered to them so that we can detect from the tests that we've got in Quebec, and there's also a genetic test for the new variant. Currently, there's nothing that demonstrates that this strain is more severe than others in terms of morbidity and mortality, but it would be more contagious. Question?
Oui, bonjour, m'entendez?
Hello. Concerning the new variant, the case that was detected in Quebec, are we to understand that the person who transmitted the variant did not respect the quarantine? No, to the contrary, the person was quarantined. It's family contacts that were exposed. So this is not somebody who traveled around. They respected the quarantine, but they did their quarantine at home. It's possible that at that time she had contacts with people from her own household, but she did not travel outside of her home. Given that the number of cases per day, can we expect that you will prolong the confinement beyond the 11th of January? We're not there yet. For all of those who are in their pajamas at home today and who are watching us, I would like to encourage them, first of all, to respect the measures that are already in place. And I say this with a bit of humor because the majority of the population is respecting the measures and they're helping it. They're helping us in our work. But to answer your question, what is important to say is that there are some measures that are quite recent. For example, for the shopping centers, they only close on the 25th of December. We're the 29th now, so let's give ourselves a bit of time. I know that the schools closed on the 17th, but we said that it's a series of measures that will make a difference. We would have liked, Dr. Arruda, myself, and the whole team, we would have liked to say that we're at 1,900 cases today, and that is not the case. But to answer your question, it's too soon to say if there will be other measures. Let's continue to follow the measures we've got in place now, and we will keep you informed. But for the time being, there are no new restrictions.
Nous allons passer la parole à Henri Ouellette du journal La Presse et je profite de l'occasion pour réitérer que c'est un représentant
Question.
des médias qui doit lever la main via l'application.
Oui, allô, vous m'entendez bien?
Très bien.
Monsieur Dubé, la question...
Mr. Dubé, the question is for you. You used to insist quite a bit. You said that we had to transmit the results of the COVID test quite quickly, but there are several people who are waiting for a long time before getting results. It's very variable depending on the regions. My first question is do you have a precise plan to accelerate the transmission of these results quickly? And earlier you were talking about rapid tests in airports.
Bon, tout d'abord, sur la question
Well, now on the question of the delays. I heard this comment, and I'm a little bit surprised because, and once again, I always question the healthcare network when I hear these comments. I did not hear that there were significant delays. Perhaps there are a few cases sporadically, but I've asked right before we came to the press conference if there were some things that I had not heard in terms of delays, and I haven't heard anything major, but if you ask the question again, well, obviously I'm going to follow up on that because now I think that one of our strengths is the screening. You'll remember that last week we went up to over 40,000 tests per day, which was, so that day, were there delays by 1 or 2 days? I don't know, perhaps. But I wouldn't say, generally speaking, that there are a lot of delays. For your second question on the rapid tests, the rapid tests, for me, are going quite well. On our end, you know that we had 2 types of tests. We're very comfortable with the ID Now tests. We validated them, and I told you at the end of December that we'd be able to use them in very specific places. Now, the question with the airport, and I'm repeating myself here, this is a federal responsibility, and we don't want to use our tests, and we don't want to do the federal's work. So the federal government must come up with a solution so that if this is the right approach to test people on site in the airports, well, it must be with material that comes from the federal government.
Excellent, merci. Deuxième question.
Thank you. Second question. Earlier, you spoke about vaccination and whether or not you'll hold the second doses. There's a study from the University of Toronto who said that we should vaccinate and use all the doses that we've got. So this is a discussion that you're having right now. Can you tell us more on what you plan to do over the next few days? Will we change the vaccination plan, as Ontario has just done? Will Quebec follow suit?
Bon, merci pour la question.
Thank you for the question. I will begin so that people understand well. And without getting too technical, we received 55,000 doses up until now. Of these 55,000 doses, there are 27,000 that we have to keep aside, and that is a Pfizer requirement. We are now at 22,000 people vaccinated. So we don't have a timing issue. Things are going very well, and in 2 days we will have vaccinated the 27,000 people. I asked Dr. Arruda with some other provinces, for example, and I'm not sure that we've got all the right information right now, but I've asked Dr. Arruda to see if other provinces, and if we could continue to force Pfizer's hand a little bit to free up these doses. Since the beginning, we wanted to evaluate the possibility of using all of the doses to protect as many people as possible. There's a lot of logistical constraints that are associated to the type of vaccine, but also some rules that the company imposed on us. But it's clear that we're thinking about this. Things are evolving. There are other provinces that have looked at this as well. The question is, we think that probably even if we vaccinated certain people with a greater delay than what's required, there wouldn't be no effect on the protection of individuals. So it's a scenario that we are studying, and we were studying it a while ago. And we will come up with a recommendation shortly for our minister, and that will be adapted to the situation that we've got in Quebec. And I want to tell you as well that the virus is not going on vacation as it is everywhere currently. And there's a lot of people who are respecting the guidelines, and that's extraordinary. But there's a minority of people who are not respecting the guidelines, and that can make all the difference in terms of number of cases. So I'm insisting on that. The vaccine will help us. It will give us hope. But we have to keep going. It's very serious. I would add perhaps one point. The fact that we have respected Pfizer's rules and that we have shown them that we were the quickest to vaccinate, I don't think that we will have any issues with Pfizer because we have followed their rules. And if they have a preference to giving us more vaccines, they know that they're not going to stay on the shelf anywhere. So what we had asked Mr. Paré is to make sure that we vaccinated correctly. We told you that we had the resources to do it. And I think that's the good news. Now, we are expecting to have some deliveries at the beginning of January, the 4th of January, and then the 11th. So I think that the issue of the half doses, we'll be able to play with that a little bit and to vaccinate and to put out all of the vaccines that we get. So it's an issue of a week or two, and that's why we've asked Dr. Arruda to continue the discussions with Pfizer so that we can come up with a recommendation. But I think it's just a question of a week and no more than that. And Daniel Paré, who's responsible for the vaccination, is following this very closely. And I want to insist, Mr. Minister, we will never take any chances with the health of Quebecers by using a modified calendar if we don't have enough data on this. Question. Mr. Dubé, you talked about travelers who may worsen the situation when they come back to Quebec. This morning, Dr. Fournier from Public Health said that he was worried about new strains that these travelers could bring back to the country. What is your opinion on this? Apart from the fact that I think like all Quebecers and the Premier and everybody on the team here, I'm shocked by the images that we've seen over the past few days, and I appreciate the work of reporters. I think that in terms of awareness raising of the population, these people are not respecting the rules, or first of all, they shouldn't have left, and they're partying over there without respecting the public health measures. I think everybody is shocked by this. But I think that the third measure that I mentioned earlier for me is the most important one. Because beyond tests, we will have to make sure that these people, when they come back, that they understand quite well, that the quarantine must be respected. Otherwise, there will be fines. There will be fines. The fines, according to the federal law, can go between $800 and $750,000. So I'd like to remind people that if the quarantine is not done, there will be some fines. Question.
Est-ce que vous m'entendez bien?
Très bien.
Alors, vous avez parlé de l'effort de vaccination.
You talked about the vaccination plan. We talked about an objective of 57,000 people vaccinated by the 4th of January. Do you think that this is still a realistic objective, or how will you accelerate by then? I'll remind you of what I've already said. We received 57,000 doses, but Pfizer, the manufacturer, is requiring that we keep half of them to revaccinate the people 3 weeks later. As long as that requirement is not lifted by Pfizer, we will respect Pfizer's rules. And that is why, as of today, we have vaccinated 22,000 people. We've got a little bit fewer than 5,000 vaccines to administer, which we'll do over the next 2 days. Our objective to vaccinate half of the people was to respect Pfizer's requirements. If that requirement is lifted, and that is what I was talking about with Dr. Arruda over the past few days, well then we'll be able to use all of these doses. The manufacturer wants to make sure that if there are delivery problems, we will be able to administer the second dose to these people. In my opinion, according to the discussions that we've had with Dr. Arruda, that restriction should be lifted in the next few weeks. But we will try to move as quickly as possible. Follow-up question on vaccination. We learned that the owner of a private CHSLD got vaccinated. How is that possible? Are the vaccines reserved to the staff or owners and managers? Are they also part of the priority groups? Well, listen, it's hard for me to answer, to address a specific case such as this one. You'll remember that we followed the recommendations of the Commission on Immunization in Quebec, which said that it's either people in the CHSLDs or workers. This person, are they a worker at the CHSLD? I don't know. We don't know the story. Unless the manager offers or provides care, that might be one of the reasons why he was vaccinated. But usually people who don't have contact with patients, if they're only in the offices, they should not be vaccinated in the first phase. But it's hard for me to comment on this. But perhaps you can send my attaché de presse the information and we'll make the verifications. Question.
Bonjour messieurs, est-ce que vous m'entendez bien?
Très bien.
Alors, en première question, j'aimerais savoir
I'd like to know,
qu'est-ce qu'on compte faire si un Québécois
what will we do if a Quebecer gets sick or gets COVID and is ill in Mexico, for example? Is it, and their insurance doesn't cover all the fees and they're stuck over there and they don't have the money to pay? Will the government pay the bill? And what do we do with travelers, Quebec travelers, who will not be able to come back home because they test positive? To your first question, I think that we have warned people the fees that they will incur abroad if they get COVID will be taken on by them because there's part of the fees that are covered by the RAMQ, but they're minimal. So we've said this several times. So to answer your question, the RAMQ pays a little bit, and most of the fees are the responsibility of the traveler who may or may not have personal insurance, but that is their responsibility. Now, and that's why we're working with the federal government to answer your second question. Somebody who is now stuck, they get a positive test. Well, it's up to them to get organized, to find a hotel room so that they can stay there while they're in quarantine. But the airline company will not let them board.
Parfait. Alors, comme deuxième question, ce que j'aimerais savoir, c'est
I would like to know, will you propose the help of police forces in Quebec to the federal government to do the verifications. So to add some resources that could go check to see if people are respecting the quarantine or not. I'm going to repeat what I said earlier. It's a federal responsibility to do the tests and to do the follow-up. The discussions that we're having right now with the federal government, well, we'd like to have either people from the RCMP or people who would be able to go do the visits on site. I'm reminding you that as of tomorrow, on the list of flights that we're sharing with the federal government, we're talking about 3,000 tourists who are coming back to Montreal and Quebec. So you can imagine the work that it will require to follow up these people during their quarantine. So we say it's a federal responsibility, and then we will see if the federal government can't do it. We'll see. We'll find some means to do it. But once again, our police officers right now are already quite busy getting the rules respected here, and that's why I'm repeating myself. We've got good collaboration with the federal government, but we have to find some solutions that are very practical.
Maintenant, Émilie Pelletier du journal Le Soleil.
Question.
Bonjour, messieurs. Est-ce qu'on m'entend?
Très bien.
Bonjour. Lors de l'un de vos derniers points de presse,
During one of your press conferences right before the holidays, we said that 10 hospitals were in critical situations. Now we've talked quite a bit about the Montreal regions. Now for the other hospitals, what's the situation right now? Is it more critical than anticipated? What's going on? I was talking earlier to Dr. Opatoni, who Deputy Minister responsible for hospitals, right before the press conference. The hospitals at Brown are in the same situation that they were in about a week ago. The number that I would like you to remember is that with the postponements that we saw to free up approximately 1,100 COVID rooms, we're at a rate of operations of around 58%. That is the balance that we must maintain. The day that we increase the number of rooms, we will have to decrease the number of operations that we do. What Dr. Opatoni was explaining to me just this morning, and that is why, once again, I'm asking Quebecers to make more efforts, is that we want to continue our non-COVID activities. So on average, if we're at 58% in Quebec, well, clearly in Montreal, we're a little bit lower than that. But what's important is that we are still able to operate non-COVID patients up to around 58, 60%, which is good news. But every time that we have to go up to 1,100, 1,200, 1,300 COVID rooms, we have to decrease the number of surgeries that we do, and that is what I'm asking Quebecers to keep in mind. The Quebecers who are still here, who did not travel, continue to make efforts to stop this increase in the number of COVID rooms. We talk quite a bit about travelers, but if we come back home, the police forces in the region of Quebec said that they were not that busy. What did you think about the discipline of Quebecers during the first part of the holiday season? Was it what you expected? Yes, I will tell you. We discussed this quite a bit, and that's why earlier I said clearly, and I'm looking for a statistic that I've got in my notes here, but Quebecers responded quite well. There was a certain number of fines and tickets that were given out, particularly in Quebec. I think there were around 60 from memory. And in Montreal, there were fewer. But I think that what we heard beyond the number of fines, police officers told us that it was relatively calm. So I would like to thank Quebecers for their efforts, and that's why earlier I said that we're not yet announcing new measures because we have to see the effect of the last measures that were implemented. But what I'm hearing from the field is that things were relatively calm, and we appreciate what Quebecers have done. Actually, in total, I found the statistics here. There were 197 tickets in total in Quebec, including 67 in Quebec. So it's relatively minor, given the circumstances. If you'll allow me, Mr. Minister, we're noticing that people have a tendency to wash their hands less than in the beginning. Social distancing is a #1 thing, and wearing the mask adequately. You know, there's still some people who wear it under their nose, and the hand washing, these are measures that we must respect. And I'm sorry for repeating myself, but it's important. Even myself, I feel that recently I'm not washing my hands as often. We're fatigued, right? But these are measures that are very, very important. Social distancing, 2 meters. And you know, there's a minority of Quebecers who are not respecting these measures, and that is why the virus is being transmitted. Please don't be shy to repeat yourself. Yes, and remind other people as well. We're almost the 1st of January. Some people will want to celebrate the new year while respecting measures. So just wash your hands. Absolutely, wash your hands. Last question in French.
Bonjour, est-ce que vous m'entendez bien?
Oui.
Parfait. Juste pour clarifier,
to clarify, if the federal government does not go as far as you want them to go when it comes to the intensification of the measures for the quarantine, will the government of Quebec add resources to do this? Well, it's a good question. You know that we're in negotiations, so I want to... It's the federal government's responsibility. I'll remind you that we've got very good discussions with them, but I am impatient. I've had a discussion with Mrs. Plante yesterday, the Montreal mayor, who's got the same concerns as we do. So I am presuming that the federal government will answer us. I sent a letter on the 24th. I had asked for an answer on the 26th. I got an answer that I communicate with you, the 3 levels of intervention. But I've got the same concern as Mrs. Plante. And if we don't get an answer, well, we'll do what we have to do, because I told you that we're not going to wait.
Et juste pour compléter, sur les vaccins de Moderna.
Now for the Moderna vaccines, when you will get the doses, how many people do you expect to vaccinate by the end of the year if we take into account the Moderna vaccines? The Moderna vaccines, I don't think that we can take them in December, because Mr. Paré was telling me this morning that it's a question of days before we get them. So I think that we're going to receive them and we'll begin the week of the 4th of January. So if all goes well with Moderna, we will begin next week. Now, on Moderna, I think we're expecting to get about 40,000. So if we get, and I don't like to say if, because usually if I say if, I make a mistake, but with Pfizer, where we're getting around 30,000 every week, if that becomes regular, that's what we're hoping for, plus a Moderna. Well, we're going to have a good month of January, and perhaps we will have vaccinated by the end of January, perhaps 100,000 people, if not more. We're not limited by the number of people that we have to administer the vaccines. We have demonstrated with the influenza that we can go up to 250,000. So we're very proud of what was done by our vaccination team. I would like the vaccines to come in quicker so that we can vaccinate our most vulnerable people as quickly as possible. We will now go to the English questions.
Monsieur David Kaufman, CJAD.
Good afternoon. Can you gentlemen hear me?
Yes.
Wonderful. Thank you both for taking my questions. I have 2 questions for Minister Dubé. We reported on CJ 8800 this morning that there are multiple COVID-19 outbreaks in Montreal's homeless community, and that the old Royal Victoria Hospital will be turned into a 100% COVID red zone for the homeless population. My question to you, Minister Dubé, is how wide scale is the problem in the homeless community, and what is being done to fix it?
Yeah, I think with the I spoke to Dr. Carman, who's the Minister of Delegate Minister of Health, this morning on this subject. What we're doing right now is making sure that we'll have a floor dedicated to a red zone for itinérants, for homeless. Because, as you know, we have in Place du Puy already a place for the itinérants that are not COVID. We're adding a second hotel where will be itinérants, homeless, that will be, because it's getting colder and we want to protect them. So we'll have a floor at the hospital that will be dedicated to the red zone for itinérants. That's unfortunate, but that's the best service that we can give them right now.
Sorry, just to be clear, you mean the old Royal Victoria Hospital, or do you mean another hospital that will have a COVID-specific floor?
We will do it at the general, if I'm not mistaken.
Okay, and as for my second question, sir, is there a contingency plan if this continues to get worse as the winter continues, and do you have more funding available that you can use to deal with this problem?
You mean more funding for the homeless?
Yes.
We will take, this is one discussion that we'll have with Mrs. Plante, because that's an issue that is really important to her. We'll follow that with Lionel Carman, but honestly, I don't think that will be a monetary issue. We just need to have the right place for them. It has never been a monetary issue, and it will not be.
Alors maintenant, je rappelle aux médias anglophones qu'il faut lever la main aussi là, via l'application pour poser les questions. Donc, nous allons céder la parole à Kevin Daugherty de iPolitics.
Hello, Mr. Dubé. When do you expect an answer from the federal government to your requests on testing for people before they leave and when they come back, and also the quarantine?
Well, my cabinet was talking to the cabinet of Mrs. Arruda this morning, and I'm sure after this point press, I will talk to her this afternoon.
Okay. And secondly, the people who say someone is in Mexico, Florida, they test positive, they can go into quarantine, they can also go into a hospital, and that could cost like a lot of money. Like I hear like $200,000 a week for hospitalization in the United States.
Mm-hmm.
Is that a problem for you? Is that, I mean, it's sort of like you've warned them, but I guess that's the price they have to pay?
Yes.
Yes. Okay. Thank you.
Nous allons peut-être laisser quelques secondes aux autres médias anglophones. Je rappelle qu'il faut lever la main via l'application. Donc, s'il y en a qui veulent poser des questions, ce serait le moment dès maintenant. Sinon, nous allons mettre un terme à la conférence de presse. Donc, je laisse quelques secondes.
OK.
Parfait. Alors, nous allons mettre un terme à la conférence de presse. Merci beaucoup à tous d'avoir été présents.
That's it for the press conference. Thank you, everybody.